Hello, everyone. Thank you for coming. Welcome to NAHDO's 40th Annual Conference. We will be starting in about 1 minute. Before we begin, we want to cover a few housekeeping items. On your attendee screen, you can enter comments or questions in the chat. We hope you will take advantage of the opportunity to engage with our speakers and other attendees. This session is being recorded. We recognize and thank the California Healthcare Foundation for being our Petabyte sponsors. Information about all conference sponsors is available in the sponsor area of the platform. Please take a few minutes to visit each sponsor's booth where you can find more information about them and find game tokens. Game tokens are keywords or phrases used in the token hunt game for a chance to win prizes in the daily drawings. Now, let me turn the stage over to Norm Thurston, NAHDO's Executive Director. Norm, the stage is yours.
Oh, thank you, Debbie. One last time. It's exciting to be with you for our final session. The conference has been everything that we had hoped it would be. Such a great engagement by both our presenters, our moderators, and the audience. We want to thank you for being with us now for this last go-around. This session is a panel discussion about NAHDO's APCD-CDL. We're going to do a deep dive into this wonderful blueprint for collecting claims and non-claims payment data. This session was organized and will be moderated by Janice Bourgault from Freedman Healthcare. And so let's go ahead and ask Janice to join the stage. Hey, Janice, how are you?
Good, thank you.
All right, the stage is all yours, and I will see you on the other side.
All right, thank you, Norm. And good afternoon, everyone. I'm Janice Bourgault, a senior consultant with Freedman Healthcare, and I'm happy to be moderating the closing plenary panel for this year's NAHDO conference. A little bit on my background. I have over 30 years of experience in the healthcare industry, including over 15 years working with and supporting the implementation and operation of APCDs. I've had the opportunity to chair NAHDO's CDL committee, working closely with Charles Hawley and many of you in developing and maintaining the APCD common data layout and the new standards for non-claim payment data collection. This afternoon's panel discussion will provide information on the APCD common data layout with a focus on non-claims payment data. Our panelists all have experience in implementing, collecting, and/or using non-claims payment data. But before we get to our panelists, we'll be kicking things off with a short presentation on the APCD common data layout. As an introduction to this afternoon's panel discussion, I'll be providing a brief history on the APCD-CDL and will also highlight available resources if you are considering adopting the CDL. But before I dig in, I'd like to first introduce Freedman Healthcare. Freedman is a national consulting firm, and we have had the opportunity to work with many of you partnering on various health data projects, providing analysis of healthcare spending, collaborating on how best to achieve health policy goals, and in supporting efforts in data collection, which leads into my topic for today, standards in data collection. First, I thought it would be fun to review the history of APCD data submission guides. So starting with Maryland's implementation of their medical care database in 1998, followed by Maine a few years later. Each of these states had their own data submission guide, and they were quite different from each other. Other New England states became early adopters of implementing an APCD and used the same data submission guide as Maine. At the time, these states all used the same vendor, and initially there was a coordinated effort to maintain a standard guide across all these states. As each new state implemented an APCD, the data submission guide started to differ due to state legislation on what data could be collected, variation in state-specific areas of interest and analytic needs, and changes in the healthcare industry. And as each state adopted their own data submission guide, it became more and more difficult for payers, especially the national payers, to maintain, update, and support multiple submission formats. Payers started requesting standardization, and also states were requesting standardization as they found it difficult to compare data with other states. In response, NAHDO and APCD Council got together with X12 to develop an X12 APCD data submission guide. This was a big change and not widely accepted, with only one state adopting this standard. Then, in March of 2016, the Gobet versus Liberty Mutual decision revived the efforts to develop a national standard. The hope was that a national standard would simplify data submission and encourage the collection of ERISA data. And once again, APCD Council and NAHDO led the initiative that involved multiple states, vendors, payers, and other stakeholders, and released APCD-CDL version 1.0 in 2018. The state of Virginia, with an existing APCD managed by Virginia Health Information, transitioned to the CDL in 2019. They were the first state to adopt the CDL. Since that time, new APCDs, California, Georgia, Indiana, and Nevada, have been taking advantage of the CDL and have been implementing it as their data submission guide. And since the CDL was first implemented, it has been updated every 2 years, with the non-claims payment guides being released earlier this year. So why adopt the APCD-CDL? First, it's the national standard for APCD submissions and uses industry standards as a reference. Using the CDL also has a very positive impact on your implementation timelines. There's no need for states to create their own specifications. They can bypass the lengthy process of developing their own data submission guides. Also, national payers are now submitting data in the CDL format. These data pools have been developed, tested, and are in production and ready to go. Similarly, data aggregation vendors have also developed their systems to be able to ingest and process the data using the CDL formats and code sets. You can also leave the Data Submission Guide maintenance and updates to NAHDO and the APCD-CDL Maintenance and Change Committee, which you can also decide to participate in if you'd like. So if you are considering adopting the CDL, there are resources out there for you to use. First, the APCD Council's website has an FAQ page that provides information for both new APCD implementations and existing APCDs who may want to transition to the CDL. I've included the link to this FAQ page on this slide. And of course, there's the CDL itself, which is now easily downloadable without the need to register or receive a license to access it. Again, this latest release includes the 3 new file layouts for the non-claim payment files, which will be discussed further as part of this panel discussion. And of course, we have each other. Collaborating and learning from each other are how we as a community support each other and improve our data collection efforts. And with that, I'll now turn it over to our other panelists. Thank you. All right, I'd like to introduce our first panelist. That's Jasmine Neeley. Jasmine manages the healthcare payments data submission process for HCI and is using her experience in developing and managing data workflows to help HCI collect data effectively. She's here today to talk about lessons learned collecting non-claims payment data in California from a state perspective. So I'll pass it to Jasmine for her presentation, and please feel free to add your questions in the chat as we move along.
Hello, folks. My name is Jasmine, and I'm the Healthcare Payments Data Manager with the California Department of Healthcare Access and Information, otherwise known as HCI. And thank you for having me today. In June 2018, Chapter 8.5 was added to the California Health and Safety Code, which provided HCI the initial authority to establish a healthcare cost transparency database. In June 2020, this chapter was amended to add the identified sections requiring HCI to administer the Healthcare Payments Data System, or HPD for short. This enabling statute provides HCI the authority to establish regulations to collect both claims and non-claims data from specific mandatory submitters. HCI began collecting eligibility, provider, medical, and pharmacy files in 2022, dental files in late 2024, and regulations were approved in March of this year, adopting the NAHDO NCP data layouts. Collection of annual payments, pharmacy rebates, and capitation files is currently in the testing period. Although governing statute gives HCI authority to collect the data, it is also important to understand the reason the statute was established in the first place. The HPD program developed 6 goals based on the legislative intent outlined in the authorizing statute. I have all 6 goals on the screen, but I'd like to highlight provide a public benefit for Californians, increase transparency, and support a sustainable healthcare system. We knew to achieve these goals we would need to collect both claims and non-claims data in order to gain a complete picture of the total cost of care in California, especially considering capitation plays such a major role in the California healthcare market. Now, from the beginning, we were interested in collecting non-claims payment data. We discussed data collection progress at our quarterly public program advisory meetings, at plan and submitter group meetings, and in fact sheets and quarterly newsletters. We were presenting information about the non-claims payment data as early as April 2019. Prior to initiating the regulations process, we sent out surveys to expected submitters to ask about anticipated fiscal impact and timelines for implementation. We also met with stakeholders one-on-one to listen and get a clear understanding of their capacity. Throughout all communications, the goals of the program and the purpose for collecting non-claims payment data was highlighted. By creating a conversation centered on use cases for the data and the resulting public benefit, it has encouraged participation in collecting non-claims payment data for the program. Now, HCI had already adopted NAHDO's APCD-CDL for claims files, and to begin collecting non-claims data, HCI successfully completed the rulemaking process, adopting the NCP data layouts. Now, the promulgation process includes public comment periods, where anyone can submit their feedback in writing to the program. We communicated the proposed regulations and encouraged public comment at the public advisory meetings and plan and submitter group meetings. We also sent email communications to all HPD stakeholders about the proposed regulations and encouraged feedback. But more important than just asking for public comment is listening to the feedback received during the public comment period and implementing changes where appropriate. During rulemaking, HCI received public comments asking for us to implement a longer testing runway for data submitters since this was a new data layout. We identified a testing start and end date and established a 10-month testing period. Now, in March of this year, we received approval for our updated regulations incorporating the NCP data layouts, and now for the last 7 months, we have been working through the beginning stages of implementation. To prepare for submission, we set up a webinar series specifically for the NCP data files and submission process. We also created custom documentation, including an NCP submission scenario spreadsheet, which outlines some of the different scenarios you might experience and how they would be reported in the data files. We arranged many one-on-one meetings with submitters to discuss any questions or confusion they might have and any needs that would be specific to their organization. So what are the biggest takeaways we've had during this process? Communicate early and frequently. Someone might be hearing it for the 5th time, but someone else will be hearing it for the 1st. Present new information and guidance to keep people engaged, but keep talking about it. Focus on the goals of data collection and connect the effort to something more meaningful than statutory obligation. Encourage and listen to feedback and be willing to make changes. Understanding where you can meet people in the middle will help your program overall. And build in a longer testing period. It will take longer than you think to facilitate testing, and submitters will be grateful for the time. This can lead to production data submissions that have already been tested and validated and will foster a smooth transition for submitters. If you have any questions about our program, you can email us at hpd@hci.ca.gov. Thank you for your time.
Thank you, Jasmine. That was terrific, especially the lessons learned. While waiting for some questions in the chat, I have a question for you.
Absolutely.
So as one of the early adopters of the non-claims payment layout as part of the CDL, can you speak to any pros or cons of adopting the CDL layout as your data submission guide for the non-claims payment data?
I would say in general, there really aren't any cons from our perspective. It has really made the whole process of data collection much more smooth for our program. So we didn't need to go through the process of developing a data layout and everything that would be involved in. We did review several layout options that are available for similar data, and we chose actively to go with NAHDO's APCD-CDL because we felt it was so robust and met our needs. And it's better for submitters. They know exactly what they should be expected to submit. It's very straightforward guidance, and if they are submitting across multiple APCDs for multiple states, it is very streamlined for them then to submit that data to multiple states because they know that the requirements are going to be mostly the same.
Great, that's great to hear. You also said that you opened for testing in September. How's the testing going?
Great.
Any lessons learned? Yeah.
Yes, we so with the NCP data layouts, we are, this is a novel adoption process, so we are learning things, but we have a very high engagement rate. We expect over 50 plans to be submitting files, and we only have 1 or 2 that have not started and engaged in the testing process with us so far. So we're seeing a really high rate of engagement that we're very, very excited about.
Great. And what are some of the use cases for non-claims payment data?
Sure. So, I think the claims data is like the traditional form of understanding the healthcare market, but non-claims payment data is really required to get the full picture. I think if you just are looking at claims, you're missing out on important information, and there are important analysis you can do, such as adoption of alternative payment models. What do pharmacy rebate rates look like? Like, what are people actually paying for their pharmaceuticals? And looking at total cost of care in California, which, as I mentioned in my presentation, capitation plays a big part in California health market. And so without the NCP data, we just wouldn't have a complete picture of what we're trying to look at the healthcare market here in California.
All right. Well, thank you, Jasmine, and we'll see you again a little later. So I'll introduce our next panelist. That's Gina Robertson. She comes to us from Onpoint Health Data, where she serves as a Senior Data Analytics Manager. Her team oversees APCD data quality and completeness reporting to ensure that state APCD teams have the data they need to inform their statewide healthcare programs and policies. Gina has supported the implementation of several non-claims payment data collection initiatives for Onpoint's clients, including use of the NCP data layout for several states currently exploring non-claims payment data collection.
Good afternoon, folks. My name is Gina Robertson, and I work in analytics here at Onpoint Health Data. I'm thrilled today to speak with you about collecting non-claims payments. Over the last decade, Onpoint has supported our clients in their collection and validation of non-claims payments, and have identified some really key learnings along the way. Before we head into our panel today, we thought it may be helpful to offer some key steps that have helped to facilitate the successful collection of non-claims data, or our blueprint for collecting non-claims payments. So this diagram outlines the key steps in our blueprint, and I'm going to take the next 5 or so minutes to drill into each one of these steps. The first step in our blueprint is engaging stakeholders in your plans for data collection. The goal of stakeholder engagement is to solicit feedback from those submitting, using, or depending upon the data so that you can confirm your efforts for data collection meet all participant needs across the board. This engagement should include data submitters who will be accountable for sending the data, researchers and program analysts who will use the data, and program leads who are tasked with meeting strategic goals or regulatory requirements that depend upon the data. We see stakeholder engagement starting with internal stakeholders by first aligning on your program's goals with input from expected researchers, program analysts, and program leads. Prepare to answer the questions: what mission is your program tasked with, and what data will be required to fulfill that mission? Answering these questions up front will help you identify the data collection template that is right for you. So, for example, some states may be tasked with collecting total non-claims payments by health plan per year to help measure statewide and aggregate annual healthcare costs, while other states may be required to report out on those same annual non-claims payments, but by subset of those payments made towards primary care. Submission specifications for both of these efforts may differ, with the second effort requiring more detailed breakout of those non-claims payments by primary care subset. So understanding your program goals and aligning with your stakeholders on the data elements needed to meet those goals is a critical first step during your implementation. Once you've aligned on program goals and selected your data collection template, the second step will be to engage your data submitters to gather feedback on your data collection specifications and on the program goals you're trying to achieve. This survey step is pivotal in identifying gaps or gray areas within your template. So, for example, health plan surveys in the past have helped us to identify alternative payment models that were not initially captured by the proposed data collections template. Opening this feedback loop allows for an opportunity for your team to refine your data collection template in order to capture all data elements or types of non-claims payments that may be required for your program goals. And finally, after those revisions take place, offer the template and supporting documentation up for review again. This may look like opening the template up for public comment or surveying specific data submitters who had thorough feedback the first survey so that you could integrate any last input ahead of finalizing your data collection guidance. The second step in our blueprint is preparing comprehensive documentation for data submission, including a detailed data submission guide, documented FAQs from data submitters, information on how the data will be validated, sample data that's annotated for submitters, and so on. The goal of this step is to promote standardization across submitter interpretation of your specifications so that the data reported can be comparable across all contributing health plans. Step number 3, I think, goes without saying and still cannot be stressed enough. Don't rush this process. Provide submitters with ample time to really dig into specifications. Non-claims payments are often stored in a whole separate system and managed by a whole separate team than claims and enrollment data. So health plans need plenty of time to coordinate across their teams, marry up their submission efforts, and ensure their systems are set up for success in starting this data transfer process. Allow submitters sufficient time to test, review validation results, and dig into their submission mappings to promote good partnerships and acquire high-quality data downstream. As you go through the implementation, offer consistent and ready submitter support. This can include things like submitter training webinars, one-on-one meetings, office hours, and so on. Regularly update and release submitter FAQs as they arise to ensure consistent interpretation of your template. And finally, maintain an internal decision log as questions do come up to ensure the answers and support your team provides are standard across submitters over time. And our last step in the blueprint is to validate. Allow for time to investigate data quality findings, to compare submitted data against relevant benchmarks, to provide submitters an opportunity to attest to their total healthcare costs. Know that submission iterations will happen, and that's okay. The more you dig into the data early on, the more confidence and trust you'll be able to place into that data downstream. So I hope this blueprint serves as a helpful starting point for states to consider non-claims payment collection. Looking forward to discussing further in our panel. Thanks.
Thanks, Gina. I don't see any questions yet, so I have some of my own. So you mentioned a submitter survey. What types of questions would you recommend including within that survey about non-claims payment data collection?
Yeah, thanks, Janice. So within the survey, I think there's really two goals of addressing questions with submitters. The first goal is gathering information through free and open-ended questions on the types of payment models that are administered by your APCD submitters. And so with that feedback, that you can help inform your data collection template and also your regulations. So asking questions like, what types of non-claims arrangements does your team administer? So you can listen to that answer and visualize how you think those models would fit into your template, or who receives a payment, so you can understand whether certain payments may be tied to a specific TIN or maybe the MPI of a provider group, so you can confirm that you're capturing all the data elements and different payment category codes that you'll need within your template. Another important question that I would really highlight in terms of recent implementations would be, how long is the contract period that it takes to have those payments become finalized? So that can help ensure that your regulations are baking in enough time within your data submission schedule. So for example, if a health plan says that it takes them maybe 12 months to finalize their pharmacy rebates data, and all those pharmacy rebates that they receive, you're going to want to bake in a data collection timeline that allows for those claims to be finalized, or allows for a refresh of that data to be finalized downstream. So those are some specific questions to gather information about what types of payment models the submitters send. The other piece of that is reviewing the spec specifically with those health plans and collecting very specific questions about each data element that you're collecting, so that you can verify with the health plans whether or not they have the data to meet that spec need, and again, bake in any revisions that you may need downstream.
Thanks. We have a question from Stefan Gildemeister. Is it correct that many states collect rebate information as part of the NCBPs, seeing that it feels slightly different from payer payments to providers? From what you know, do those states have separate authority to acquire RX rebate information?
Yeah, that's a great question, Stefan. So far, we have been working with states that are collecting pharmacy rebates data. Jasmine and the HBD program are one example of a state that is using the pharmacy rebates file within the the non-claims payment data collection standard for the CDL. So yeah, and as far as I know, they have not had to pass separate authority to collect that information, but that's something we can certainly follow up on and get an answer for you on that.
All right. Thanks, Gina. I have another question for you. You mentioned about validate. So what types of validations would you recommend generating on non-claim submissions?
Yeah, so aside from your standard, formatting and data element completeness checks, the key in configuring validations that will be effective for your program is thinking about how you're going to be using the data downstream and what expectation you have about the formatting of that data. So one key example would be for the annual payment submission in the NCP data layout, for example. If you expect payments to be collected at the grain of contracted payment, billing provider, payment subcategory, and so on, ensuring you're configuring validations that flag any duplicate rows of data that may show multiple rows of data being sent. Another piece of that validation process that we think is really important, aside from measuring the interrelationship between fields in that file, like these duplicate checks, would be checks that allow for you to have the submitters attest to the data that they've sent. And so taking time to summarize the information that the payer has provided you downstream, sending them some model PMPM values, for example, can help engage them in the process and show them what their results in the aggregate data sets look like, so that they can attest to the data that they're seeing downstream.
All right, thank you. And one last question. So what are some of the more frequent questions you're hearing from submitters as they are implementing and testing the submission of non-claims payments?
Yeah, thanks, Janice. So I'll stick with the NCP data layout for this question. And so lately, the questions we've been getting revolve around specifications that the CDL allows for different states to define according to their own state needs. So a good example would be in the annual payments file, there's certain fields for collecting primary care and behavioral health total amounts. per different contract payment. And so for those fields, we've been getting questions about the definitions for those and how to make sure that submitters are populating those fields properly, making sure you have supporting documentation that really flushes out those definitions really clearly with sample data, I think helps the submitters to understand those types of specifications really clearly for their teams. The other piece we've been receiving questions about are how to integrate in monthly capitation files any adjustments that occur over time. So we know that capitation payments can be adjusted over time, and on a monthly basis, we'll need to be able to capture those adjustments. So working with your data vendor in, again, developing that supporting documentation, we developed a submission scenarios document for HBD that shows very specific examples of how submitters should be sending those adjustments over time. So making sure you have that standard documentation to clarify those questions for your submitters will really help set them up for success.
Great, thank you. And we'll see you again a little later also. Before we dive into our last panelist, Dawn, I saw you note in the chat that Arkansas is also planning on collecting pharmacy rebates. If you're able to share whether you needed separate authority to acquire that rebate information, that would be helpful to respond to Stefan's question. Thanks. All right, so our last panelist is a colleague of mine, Vinayak Sinha. Vinayak is a senior consultant at Freedman Healthcare who has spent the past decade supporting stakeholders with value-based care initiatives. This includes understanding healthcare spending by designing data collection and analysis efforts and reporting on actionable insights to impact policy. Vinayak's work has included co-developing the expanded non-claims payment framework with California's Department of Healthcare Access and Information, which is incorporated into the APCD-CDL. His work focuses on value-based care models, primary care and behavioral health investment, and affordability. Today, Vinayak will be discussing how to implement tailored non-claims data collection using the APCD-CDL layout to meet state goals for collecting these data. This includes what kinds of goals states have for non-claims data collection and the modifications needed to meet these goals. And so now to Vinayak.
Great, thank you, Janice. I'll spend a few minutes to review the use of non-claims payments before we move on to our discussion. The map on this slide highlights 11 states that currently collect non-claims data, all of which are collecting the data to meet different state goals. State agencies like Medicaid may also be receiving non-claims data, but may not publish them publicly. As Janice mentioned earlier, the APCD-CDL is being implemented in a few new states like Georgia, Nevada, Indiana, and Virginia, which we hope will also collect the non-claims data. Next, just wanted to discuss why states are collecting this non-claims data. There are 3 related state goals for measuring non-claims payments. The first is to better understand spending. States may want to understand total healthcare expenditures, behavioral health, or primary care spending, all of which have a portion of payments via non-claims. The second is to better understand the types of payment arrangements within payer and providers, both public and private, whether to understand the engagement of providers and members in these payment arrangements, their success, or the level of risk providers are willing to take on. Collecting non-claims payment data is essential. The third is understanding movement away from fee-for-service to align incentives for providers across payers to provide the right care at the right place and time. This includes adding non-claims data to APCDs to understand payment granularly, the percent of spending outside of claims payments, and how non-claims payments are paid across providers to understand care transformation. Next, we'll discuss some modifications to the annual payments file within the CDL to support these use cases. California's Office of Healthcare Affordability, or OCA, collects data on total healthcare expenditures to determine payer progress toward meeting a statewide cost growth target. Note that while this office is within California's Department of Healthcare Access and Information, it is not the office that manages the APCD that Jasmine discussed. The data was collected using specific definitions for payment categories included in the APCD-CDL to support California data submitters in categorizing their non-claims payments without getting into too much detail on the specific purpose of payment. OCA collects this data in aggregate at the submitter level and at the provider organization level to understand spending within the state, which is similar to the way that the annual payments file is laid out in the CDL. OCA also uses a tailored version of the NCP payment categories and subcategories to collect non-claims payment primary care spending data to evaluate progress towards primary care investment benchmarks. To do this, OCA provides specific definitions for primary care specific payment subcategories, such as primary care and behavioral health integration payments, as well as has developed detailed methodologies to support data submitters in apportioning these non-claims payments to primary care. OCA collects this data at the submitter level to evaluate payer progress toward their primary care investment benchmarks and to support conversations on how to increase investment to meet the state vision for primary care delivery. OCA also uses a tailored approach to understanding alternative payment models, or APMs, within the state as well. This approach includes developing a methodology to allocate member months and payments within payer-provider contracting arrangements to non-claims payment subcategories included in the annual payments file of the CDL. The graphic on this slide supports submitters in understanding how to submit data within the APM file, and OCA works closely with submitters to provide guidance on how the claims and non-claims payments in their contracts should be categorized. OCA collects this data at the submitter level to evaluate against payer type specific APM adoption goals in the state. And this gives us another example of how to use non-claims payment data using the APCD-CDL. With that, I'll hand it back over to Janice for us to discuss this work further. Thanks.
Thank you, Vinayak. We do have some questions for you. So from Kenley in Arkansas, what is the best source for the foundational definitions for the primary care and behavioral health money in the NCP data?
That is a great question. Also, not an easy question because states often really vary what they consider primary care or behavioral health. Though there are a number of states now really working to coalesce around specific definitions related to primary care, whether that means being focused on a specific set of providers, places of service, and services to define the claim spend, as well as for behavioral health through a standardized definition that the Milbank Memorial Fund and Freedman Healthcare put together, which was actually applied in California's HPD to look at commercial spending for behavioral health. So those are on the claim side. On the non-claim side, for primary care, the APCD-CDL's annual payments file actually includes a number of payment subcategories that are primary care specific. So whether that's primary care and behavioral health integration payments or primary care capitation, those ones are the most clear cut. And then of course, there's some other non-claims payments that we may want to attribute some portion of to primary care. And there isn't necessarily a standard methodology around that, though I think California has used those APCD-CDL payment subcategories to develop one. And Maryland is now using just the payment categories without the additional layer of the subcategories to develop some definitions around what counts as part of primary care non-claims payments.
Thank you. Another question for you. How can states use the APCD-CDL annual payments file to meet multiple goals for data collection in one data request?
This is one of the things that excites me about the annual payments file, actually. I love that there is an additional column or field in there for the primary care spend amount, for behavioral health spend. One of the great things about that annual payments file is it allows folks to collect data both in totality when looking across all of the payment subcategory payments. So whether that's specific performance payments, capitation payments, so on, as well as claims. Those are included there as well. And then it also has the fields that include the primary care spend or the behavioral health spend. So meeting a number of those use cases I just mentioned. The one part that's a little bit harder to collect all within that same data collection or same file submission is the alternative payment model data submission. And that's because that often is a little bit different in terms of a state's goals. And so states are often looking at the percent of total spending within a particular market that is moving through an alternative payment model contract, which requires a little bit of a different allocation methodology for both the spend and the member months. And so that specific use case is a little harder to meet within one file's data collection, but again, definitions and payment allocation methodologies can be modified using the same file.
Right. Thank you. And now we'll bring back our other panelists, Jasmine and Gina. And welcome everybody back. And with everyone here, Vinayak touched upon primary care and behavioral health a little bit, but we have a question from Train from Civic. Basically same question and wondering if you know how other organizations or states identify behavioral health claims.
I can speak to the California experience on this. I can't speak to other states, but we do have, so I'm part of the, the area that I am in is separate from OCA, but OCA has developed some logic and code sets for primary care and behavioral health that we are adopting or want to incorporate into our submission process. So we are looking to, offer a pretty robust code set to our plans and submitters to answer that question for them.
Sure, and I can add a little to that. Actually, one of our sessions earlier today at the conference was from the HPD team and the OCA team in California using that behavioral health definition. And so feel free to take a look at that recording, but at a high level, what that spoke about is the implementation of something that our team worked on with the Milbank Memorial Fund to develop a standardized definition for identifying claims. For behavioral health, as well as non-claims. At a high level on claims, there maybe two or a few main methodologies that are out there. The first one is identifying behavioral health spend based on the primary diagnosis on a claim. So having a list of behavioral health related diagnoses, as long as they're included as the primary diagnosis, the spend associated with those claims gets included as behavioral health spend. Another method that's used in conjunction with this one in Maine, actually, is to identify when over 70% of a provider's, any specific provider's claims are have a behavioral health primary diagnosis. So even if some portion of the provider's claims do not have a primary diagnosis for behavioral health, they would still get counted, appreciating that that provider is generally treating behavioral health. So that's another way. There are, of course, a few different ways to identify behavioral health spend, but another would be just to come up with a list of behavioral health provider taxonomy codes. A little bit harder since a lot of folks are specialized in a couple different things there, but that is an option as well.
Yeah, from what I've seen, I would just add, it seems to me like many states are using their own specific definition or building off of those definitions that Vinayak just mentioned. And I think it is a really exciting opportunity, Vinayak, like you said, to help to standardize and more formalize some type of definition that folks can agree upon within the CDL potentially in the future. I know, states have varying needs. There may be differences in needs for the definitions that they use depending on their program goals and all that. But I think as we help submitters to send data more standardly across those programs, having one common definition that they can refer to will be a really exciting piece of the puzzle. So hopefully more to come on that in the future.
Great, thank you. Question for all of you. So when APCDs first started, there was quite a bit of pushback from payers. And then as more and more APCDs were implemented, and then the implementation of the APCD Common Data Layout, there seems to be little to no pushback from payers now as far as the claims side of the house. I'm wondering if you're starting to see the same thing occur with the collection of non-claims payment data. As we heard in one of yesterday's session, Donice Lewis from VHI informed the group that they had reached out to payers for comment on the collection of non-claims payment using the CDL standard and did not receive any feedback, and instead received questions more around like when the data would be due, what's the testing period, those type of questions. So question for all of you is, have you had the same experience as more and more states pursue the collection of non-claims payment data along with using a standard? Is there more acceptance from payers? And I'll start with you, Jasmine. So when working on the legislation, you did reach out to submitters. So what was your experience there?
We have, like I said earlier, we have a really high rate of engagement in our process at the current time. We're still only in the testing period, but we're seeing, most, if not almost all of our plans are engaging in that process. And I think a combination of how early in the process we were communicating that this was coming ahead of time, and then also talking about the data benefits that would come from this data and connecting it to the benefit to Californians, because we are a state agency, has really kind of paved the road for people to want to engage in the program and make it, I think we've done a good job of trying to make it as smooth and painless as you can. It's a complicated process. Data is messy. We all know and acknowledge that, but we do our best to stay in communication, to really highlight the reasons that we're doing this more than just you have to. And I think it has created a positive atmosphere for our program and really high engagement in our program for sure.
Thanks. Gina, how about on the data collection front? Are submitters becoming more familiar with what is expected in these data submissions?
Yeah, I think certainly integrating the NCP data layout within the CDL has really helped to promote a standard for them and something that they can turn to and think through as, an upcoming expectation. I think to a certain point, health plans know that this is important information, that this is going to be requested of them at, a certain point in time. And I think Jasmine and HPD program really nailed it in terms of outlining the reason why. It's so important for them to see the importance of sending this data. And so I think once that messaging is promoted and shared, I think there's a certain also partnership with the health plans to say, hey, we want to help you meet your program goals. We want to help be a good collaborator. And certainly embracing the standard of the CDL has helped to combat against the pushback, I think. So that's what we've been seeing too, which is great and exciting.
Great. And Vinayak, you've been working with non-claims payment data for quite a while. Have you seen a change in how submitters are responding to the requirements of reporting this data?
Yes, and very thankful for that. Really appreciate the health plans really engaging with how the data is being collected, some of the nuances. I appreciate that states originally were definitely collecting the data in different ways. There are different frameworks. I'm really happy to see something standardized out there now. But what we're really seeing is the questions that are coming in as states are starting to think about collecting the data have actually really slowed down in terms of folks understand why non-claims data is important, that they may need to submit it, and are getting more familiar with the fact that they may need to do that, and potentially how to do that. One of the things that's really heartening is seeing plans discuss and share their payment models and their payment arrangements, their non-claims payments, and say, okay, these categories make a little bit more sense. they align with what's in our contract a little bit better. And we've seen that change in a couple states as well, as states have moved from one framework to the framework that's included in the APCD-CDL. The plans are saying that makes sense. They're able to crosswalk their data from one framework to another. They're able to more accurately categorize their non-claim spend. And we appreciate that. I think that that's resulted in sometimes more questions related to just some technical assistance on making sure they understand. But in general, a lot less pushback, fewer questions, and a better understanding of some of the reasons for the non-claims data collection, which I appreciate.
Great. So I have a three-part question, and Gina, you touched upon this a little bit as far as timing of submissions and frequency. So for states looking to implement the non-claims payment data, what are your recommendations for? One, how many years of historical data would you recommend collecting? What would you recommend for the submission frequency? And when submitters are reporting the latest year of data, how many previous years of data would you recommend that they refresh?
Great question. So I think to answer the first question about how many years of historical data, your program has to focus on what you're going to need to meet your program goals. And so certain states have regulations in place that say they have to report out publicly on measuring APMs, across a specific span of time. Certain states may say from an ongoing basis, we implement this moving forward, and moving forward, we're going to be measuring this specific type of non-claims payment arrangement. So in part, it depends, I think, on your program goals, what you're trying to accomplish and how. And I would say, typically, if you don't have a framework for that, if you're looking to just have, a baseline recommendation, we usually say about 3 years of look back is typically stored readily in different payer warehouses. That's what we see often from the claims and enrollment side. The same is usually the same with the financial side. So if you're looking for something, you don't have a program goal recommendation, that's what we would recommend. For the other two questions, I think, as I mentioned before, it really depends upon, in your conversations with submitters, how many months do they, vocalize that it takes them to finalize those payments. And so I could see refreshes being really helpful if you need the data earlier. If you know you're going to collect some data ahead of the date that they vocalized would be, past their contracting finalization date, then I could see refreshes being really important to make sure you get those final dollars downstream. And I could also see that your data collection schedule itself may want to mimic how they're vocalizing the period it takes to have those payments become final. And so particularly, I think with rebates received, it takes at least, I think, upwards of a year to have those payments become final. And so setting a data collection schedule that aligns with getting those payments to their truest form is really what will help you inform that decision.
Vinayak, Jasmine, anything else to add?
Sure. A +1 to everything Gina mentioned. Definitely agree on that end. One of the pieces Gina was talking about in terms of when in the year you might collect the data, I think that we're typically seeing plans say, give us at least 9 months after the performance period ends. And that's when you should collect, if you're collecting non-claims data, in particular, non-claims data. The other thing that I think is very much tailored, depending on who you're collecting the data from, if they're Medicaid managed care plans or managed care organizations that you're collecting data from, their timing looks a little different. I would mention that particularly in the MCO space, you may expect that, yes, you'll get some data 9 months post-performance period. You'd probably expect that you need to collect that data again to get a more robust set of data. The adjudication systems there may take longer. There may be state-directed payments that need to flow through that may take some additional time to collect and to be finalized. And so would just mention that there is a little bit of nuance there. And that in my experience, as we look at non-claims data being collected year after year for the same performance year, there are always tweaks. Sometimes mostly minor tweaks as you get past 18 months after the performance period. But in that first kind of 9 months versus 18 months, you see some pretty significant differences in what is coming out in terms of the adjudication of the non-claims payments. And I think part of your question was frequency. I would say annually for some of these payments, particularly as we think about shared savings payments or performance payments, the reconciliation period is normally after the performance year. And as we've been talking about, it can take up to about 9 months at a minimum.
I'm happy to talk about California's submission schedule, which is for the traditional claims. It's monthly, and we collect it the first business day of the second month post the reporting period. So January would be submitted March 1st, February, April 1st, and continues throughout the year. For our non-claims payment, we collect capitation, or the intention is to collect capitation on a monthly cycle, and annual payments and pharmacy rebates on an annual cycle. And we did have the annual submission for annual payments and pharmacy rebates in like mid-September to really give plans that time to adjudicate those claims and work out that data so they have it to submit. In our surveys and outreach that we did, we were told 9 months is very standard, and so that is what we chose to adopt. The capitation though will be monthly, and we are working through kind of what the adjustments that are going to be made and how that submission cycle is going to flow. But that's how we've set up our submission cycle. Oh, and you asked about historical data. Our historical data is set in statute. So it's based off of our original statute date, and we are allowed to seek back to end of June 2017. Now that is very old data at this point, because it was the original statute was like 2.5 years or 2 years from the date of this of the statute. We recognize that there are plans that are not going to have that data available. It may not exist anymore. And we will work with plans on an individual basis to determine what historical data is reasonable for them to submit and what they have available.
All right. And in closing, are there any closing thoughts you would like to share?
Is that to me or to?
You could start if you'd like, Jasmine.
I think having started this testing period, our testing period opened in September. We've had a really high engagement, and we've been really happy with the amount that our plans are engaging. They're asking questions. They really, and none of it is, why do we have to do this? It's all, very specific about data layouts and questions. And so I think the messaging and how long and early we've been talking about it. We were talking about it in 2019, and we didn't adopt regulations for NCP until March of this year. So by having that really long run up, it was very expected. Nobody was surprised. We just had a public comment period on the NCP data layouts. We only got one public comment. We're currently in another public comment period, so we may get more. But so far we're seeing really high engagement.
Right, and I just want to pause on closing thoughts from Vinayak and Gina. We do have a question from Stefan. Vinayak, I really appreciate your point on the length it takes to adjudicate some of these data. What does that mean for the signal that payers are hoping to send to providers?
That is a broader conversation that I'd love to get into. The immediate part that I would react to on that is that I think it makes it pretty clear that payers are taking their time sometimes to adjudicate these payments. The amount of time taken to adjudicate is often included in a contract. There is significant variation, which sometimes means, how does that impact provider adoption of models where these non-claims payments are included? If you're getting your non-claims payment that you have worked hard for throughout a performance period, 18 or 24 months after the performance period ends, how does that actually support care transformation, or does it? How long does it take to transform care delivery through non-claims payments with that? I think that's something that's really important for regulators and states to think about, and to encourage via whether that's alternative payment model contracting standards or other pieces to ensure that both payers and providers are able to include non-claims payments in a way that actually support care transformation. That may include provisions for adjudication and what that timeline looks like. And there are various ways I think that could move in contracting, but I think that that is a pretty clear signal that we're not going to give you a ton of transformative care dollars via non-claims for you to use in the short term. That's part of the issue there.
All right, we're out of time, but Gina, did you want to say anything in closing?
I think in closing, we've all kind of said it, but I'm really excited that the NCP data layout has become part of the CDL. It provides the opportunity for us all, Janice, as you said at the start, to become collaborating partners and learn from one another as states. And so I think the spec is starting well and just going to grow stronger, through all these cycles of strengthening the specs and technical requirements. So I think we have more to come, and it's an exciting time.
All right. And with that, I'm going to count your response to Stefan as your closing remarks since we're out of time, if that's okay. I'll hand it back to Norm, but want to really thank you for all your time and expertise.
Thank you, Janice. Thank you, Vinayak, Gina, Jasmine. It's been a fantastic session. Wonderful way to conclude our conference. Thank you to everybody that's participated in any of our sessions in any way, as a presenter, as an attendee, as an organizer. We literally could not have done it without you. There was no way this could happen. So what's next? So in all of our sessions, we've had an what's up next banner. So Charles, let's go ahead and put that up there. Up next is we're going to see you all in Miami, May 6th to 7th, 2026. By the way, this conference broke an all-time record for NAHDO, 495 attendees. That's the most people ever to attend a NAHDO event. I don't know that we have room for 495 in Miami, but we surely have room for everybody that can get there. So we would love to see you with us in Miami. Charles, did you want to say a few things as well?
Yes, I'd love to see all of you in Miami. And I was just thinking later, the thought in my head was, if there are that many of you, we will need to get a bigger hotel block. So
we're going to need a bigger boat. That's what. Yep. That's one of my favorite lines from all movies ever. I think we're going to need a bigger boat. So we have 495 you show up. I think we're going to need a bigger hotel, and that will be great. We'd love to have that problem. So excited. And again, thank you all for this session. And hopefully, if you have questions about CDL or non-claims payment, any of our panels will be happy to talk to you about their experience and be able to guide you with getting answers to those. So thank you all, and we will see you in May.
Right. Bye. Thank you.